My name is Patrick Jarvis. It is 3:40 p.m. It is February 17th, 2016. I'm here to show proper procedures for the bedpan, bed bath, and occupied bed. Hey sir, my name is Patrick Jarvis. I'm going to be your nurse today. Can I get your name and date of birth?
Stephen Barrett, 11/18/75.
Well, Steve, I understand that you need to use the bathroom right now.
Yes, sir.
All right, well, we're going to get that taken care of. Along with doing that, after we get that taken care of, we're going to get you a bed bath and get you some fresh, clean sheets and blanket. Is that fine?
That sounds great.
Cool deal. Well, let's make sure that this bed's locked here. Okay? I'm going to wash my hands real quick.
Okay.
Put on some clean gloves. Provide some privacy here. Gonna raise your bed up, Steve. Is that okay?
Sounds good.
I'm gonna lay you down, okay?
All right.
I'm gonna cover you here. If I can, get you to roll over on your side, please.
Absolutely.
All right. Just cover it back up. I'm going to sit you back up. Just lower it back down. I'm going to get your call light right here. I'm going to step out and give you a moment. Whenever you're done, just give me a beep and I'll be right back in here.
All right, thank you.
I'm coming back in. I'm gonna re-wash my hands, and before I left his room, I would have washed my hands. I'm gonna wash my hands again, get some clean gloves on. All right, Steve, let's get this privacy going again. I'm gonna raise your bed back up.
All right.
I'm gonna lay your bed down, okay? If I can get you to roll over, I'm gonna grab a hold of this bedpan and hold it while you roll over.
All right.
Thank you. Okay, you can roll back over. I'm gonna empty this bedpan and clean it out. Now I'm gonna take my gloves off, wash my hands, put some new clean gloves on, and I'm gonna allow Mr. Steve to wash his hands also. Okay, now we're gonna go into the bed bath. Steve, I'm gonna lay this on top of you, okay?
All right.
If I can get you to hold that while I pull these sheets out from under you.
All right.
I'm gonna leave your feet covered up until we get down there, keep your feet warm. Gonna get some good, clean, warm water. Steve, you wanna try that out?
That is great.
Cool deal, thank you. Right now, there's no soap. Pull my sleeves up. There's no soap, just plain water. We're gonna clean inside of his eye toward the outside. Inside toward the outside. Now we're gonna clean the rest of his face, neck area, down the ears. I'm gonna assess him also while I'm giving his bed bath to make sure he's got no redness going on or any bed sores happening. Now we're gonna start using soap with the rest of the bed bath. Pat your face dry. I'll get you to lay your arm there. From here on out, there is soap being used. I'll clean your arm under your armpit there. Wash it real good. Clean your hand in between your fingers. Okay. I'm gonna rinse this out. I'm gonna do this again to get soap residue off. Armpit again. In between the fingers. Pat you dry there. deal. Okay, you can raise your arm up for me. Thank you. Steve, I'm gonna uncover your leg here.
All right.
If I can get you to raise your foot up for me and get this under there. I'll clean his leg, top first, and then go underneath. If I can get you to raise your leg up for me. You're gonna get in between his toes. Rinse it off, do it again to get the soap residue off. In between his toes. Thank you, Steve. I'm going to discard this rag. Got you dry there. All right, Steve, thank you. If I can get you to raise your leg up. Get you covered back up there. At this point, I am going to change the water out, get some new, clean, fresh water. Would you like to try this new water out, Steve?
That's good.
Full deal, thank you. My new rag. Get you, put your arm on there. Thank you, sir.
Absolutely.
Under his armpit. Get his fingers in between his fingers real good. Thank you, sir. Rinse this off again. Get the soap residue off. Between the fingers. Thank you, sir. Pat you dry here. I need you to raise your arm up. Thank you, sir. Now, Steve, what we're going to do next is clean your chest area.
All right.
Is that okay?
That sounds good.
You doing good so far?
Doing great.
Clean his chest area. Rinse this off. Clean the soap residue off. Pat you dry here. Screw it back up. I'm gonna throw this next and clean your leg off.
All right.
And get you to raise your leg. I'm going to change this towel out. Get you a new dry towel. Clean top of the leg first. And get you to raise your leg. Thank you. Be sure to get in between the toes real good. Rinse this rag off. Make sure you get that soap residue off. In between the toes again real good. Let's get your padded dry down here. Make sure to dry off in between the toes. Steve, I'll get you to leave. Thank you, sir. Just cover it back up. What we're going to do next, Steve, is we're going to clean your back.
Okay.
I can get you to roll over to your side. Thank you. I'm going to change my rag out now. Discard this with this towel and the dirty linen. I'm going to change my water out also. Get some new, clean, warm water. Steve, would you like to try this
Oh, that's good.
Clean this back real good. Okay, rinse this off, get that soap residue off his back. Get your padded dry. Like you want to roll back onto your back. At this point, I would perform Pericare. To do that, I would expose Steve. In a patient that is uncircumcised, I would pull back the foreskin. I would clean in a circular motion, working my way towards the back. Then I would rinse it off, rinse the rag, do it again to get the soap residue off. I'd pat him dry. I'd have him roll over on his side, and I would perform anal care also with a new rag. I'd wash him, I'd rinse the rag and get the soap residue off, and then pat him dry. At that point, we'd be done with the bed bath. I would assist Steve in getting his new robe on, tie his robe on, and I would run it underneath this this towel, pull it down, and help him get it tied. Now, Steve, we're gonna go ahead and get these sheets changed out. We'll discard all this into the dirty linen. Discard these sheets into the dirty linen.